serum cholesterol estimation, we will use CHOD-PAP method. CHOD stands for cholesterol oxidase, P for peroxidase, A for amino antipyrin, and P for phenol. So, regarding the reaction, cholesterol ester will be present in blood serum. It will act with water. With the help of cholesterol esterase, it will form cholesterol and fatty acid. Okay. Then cholesterol will act with cholesterol oxidase and will form cholestanol and H2O2. Cholestanol and H2O2. H2O2 with the help of 4-amino antipyrin and phenol, it will give quinoneimine dye. That quinoneimine dye will be red color. So, we will get the with the help of intensity of the color, we will get the concentration of the cholesterol into the sample. Now, cholesterol is synthesized in liver, adrenal cortex, ovary, testis and intestine. And cholestanol, quinoneimine dye. Quinoneimine dye. So, that will be formed, cholesterol will be formed in liver, ovary, testis, intestine and adrenal cortex. So, cholesterol will be formed liver, ovary, testis, intestine and adrenal cortex. Cholesterol where you find in blood, bile and in brain. Brain, their cell membrane fluidity will be maintained with the help of cholesterol. Okay, in the membrane there will be cholesterol. Now, condition regarding when you will get hyper and hypocholesterol in the blood. So, hypercholesterolemia means increased cholesterol in blood. Okay, you will get it in diabetes mellitus, nephrotic syndrome, hypothyroidism, so hypercholesterolemia you will find in diabetes mellitus, nephrotic syndrome, hypothyroidism, hypercholesterolemia and hyperlipidemia. Hypercholesterolemia increased cholesterol, so you will see in hypercholesterolemia. Hyperlipidemia, cholesterol plus triglyceride. So hypercholesterolemia and hyperlipidemia you will see increased cholesterol. Other than that, diabetes mellitus there will be increased acetyl CoA pool. From that cholesterol will be formed. Okay, So diabetes mellitus, because of increased acetyl-CoA pool, it will be increased formation of cholesterol. There will see increased formation of cholesterol. For nephrotic syndrome, you have decreased albumin and there will be increased globulin plus lipoprotein. In this lipoprotein, you will be having cholesterol. Okay. So in nephrotic syndrome, decreased albumin, there will be increased globulin and lipoprotein. So there also you will see increased cholesterol. In hypothyroidism, there is decreased HDL receptor in liver. So their liver will not excrete, the excretion of cholesterol will not be happening properly. So hypothyroidism also you will get increased cholesterol. And hypercholesterolemia, obviously it is increased cholesterol, and hyperlipidemia you will also see increased cholesterol. So all the points and the causes you got: decreased albumin, and there will be associated with increased globulin and lipoprotein. That lipoprotein is the one of the component can be cholesterol. So there is increased cholesterol formation. No, hypercholesterolemia, one is a condition, is hypercholesterolemia, one is a condition, that is type 2A. Type 2A, one condition is there, hypercholesterolemia. That Fredrickson classification is there, one classification, there is one component is hypercholesterolemia, that is one familial condition. In that condition, you will also get hypercholesterol into the blood. Okay. And hyperlipidemia, you will also see increased cholesterol. Okay. You got the point. So what is the reason for hypercholesterolemia? Any doubt? Diabetes mellitus, there will be increased pool of acetyl-CoA, that will go for cholesterol formation. Pool, increased acetyl-CoA pool, increased acetyl-CoA. Hypothyroidism, decreased HDL receptor in liver. So cholesterol excretion is not proper, so increased cholesterol into the blood. Yeah, hypercholesterolemia, that is Fredrickson classification, I will tell later. Fredrickson classification, there is specifically one entity is there, that is hypercholesterolemia type 2A. There is LDL increased and that is LDL receptor defect. So there will be, we will see increased cholesterol. Anything, any doubt? I will wrap it up. Now for hypocholesterolemia, this is hyper and this is hypocholesterolemia. In that we will get malabsorption and malnutrition. So one of the component from intestine, cholesterol is forming one of the sites. So there is malabsorption and malnutrition, you will get hypocholesterolemia. Another thing, HDL receptor related hypothyroidism will cause hyper, and hyperthyroidism will cause hypocholesterolemia. Other than that, liver disease. Liver disease. Liver is the one site of formation of cholesterol. So in liver disease related. Fredrickson classification for all that lipoprotein and hypercholesterolemia. For that, 1, 4, 5. There is some types are there. First I am telling 1, 4 and 5. There will be increase of triglyceride level. Type 2A is hypercholesterolemia. This is familial. Okay. Hypercholesterolemia. This is cholesterol, this is triglyceride. In 2A, there will be hypercholesterolemia. Here will be increased cholesterol. Okay. Type 2B and type 3, this is hyperlipidemia. Both triglyceride and cholesterol will be increased. Okay, we can remember now 1, 4, 5 triglyceride. Okay, 1, 4, 5 mnemonic if you can make 1, 4, 5 triglyceride. 2A specifically hypercholesterolemia, and type 2B and 3 is hyperlipidemia. Triglyceride and cholesterol both will be increased. Lipoprotein here is increases chylomicron. First one is chylomicron, lipoprotein type 3 and 4, 4 and 5, 4 will be VLDL and 5 will be VLDL plus chylomicron. If you can remember something, chylomicron and VLDL 5 is together, and first one is if you remember chylomicron and fourth is will be VLDL. Okay. Last one VLDL plus chylomicron. Lipoprotein that is VLDL plus chylomicron. Here it will be hypercholesterolemia, there will be LDL, increased LDL. Here LDL receptor defect is there. And increased ApoB also will be there. So here type 2A will be LDL, lipoprotein will be increased. Here only LDL. Here if you have to remember, here both is increased, right? One component, if you think LDL is cholesterol, VLDL it's the component of triglyceride actually. So this is, you will remember VLDL and LDL will be for type 2B. Okay. And for type 3 is broad beta VLDL plus chylomicron. Broad beta VLDL, actually this is ideal. Broad beta VLDL plus chylomicron. So you can remember now how to remember 1, 4, 5 triglyceride, 2 cholesterol and 2A cholesterol, 2B and 3 is both triglyceride and cholesterol. And if you have to specifically remember hypercholesterolemia, you have to write, means it is very important. So LDL you will not forget. Type 2A hypercholesterolemia, that is LDL, increase LDL, and defect is increase LDL receptor defect, and also increase ApoB also will be there. So there is type 2A, this one you have to write. Okay. Then 2B and 3 both triglyceride and cholesterol, and 1, 4, 5 is LDL and chylomicron, and first one is chylomicron, increase lipoprotein is chylomicron, and type 4 is VLDL, and 3B is LDL plus VLDL, because both triglyceride and cholesterol is increasing. So one is LDL, cholesterol, and VLDL from triglyceride. Okay, so VLDL and LDL will be increased, and type 3 is broad beta VLDL plus chylomicron. Any doubt regarding this? You can mug up this chart now. You don't have to mug up too much, just remember some of the tricks and try to remember. It will be tough for 1, 2 times maybe, after that it will be fine. Okay. For diabetes, nephrotic syndrome and hypothyroidism, both triglyceride and cholesterol will be increased. Both components, okay? Diabetes, nephrotic syndrome and hypothyroidism, both triglyceride and cholesterol will be increased. This is serum triglyceride, this is serum cholesterol. For what happens obstructive jaundice, here cholesterol is there in bile but it is not excreted, okay? So there will be increased serum cholesterol in obstructive jaundice. Only cholesterol will be increased in obstructive jaundice. In pregnancy, oral contraceptive pill and alcohol, there will be only increase of triglyceride. Anyone having alcohol, there will be increased cholesterol. Pregnancy can lead to increased cholesterol and OCP also will lead to increased cholesterol. Okay. Huh? What? Triglyceride will be increased. Here only triglyceride will be increased, no cholesterol. Here whatever there I told increase acetyl CoA, that will form that glycerol also and cholesterol also, acetyl CoA. So glycerol will go for the triglyceride formation, okay, and triacyl glycerol and cholesterol acetyl from acetyl CoA will form the cholesterol. So from diabetes mellitus, acetyl CoA is giving the two forms, so it is increasing both. Okay. For nephrotic syndrome, lipoprotein is increased. So lipoprotein, all the form triglyceride and cholesterol both will be component will be there. And hypothyroidism, HDL receptor is less in liver, so cholesterol excretion is not proper. Maybe their triglyceride is not written in the book. I have to search a little bit more. But here we can see hypothyroidism, there is increased triglyceride also. And this thing specifically, why it's increased triglyceride, I have to check a little bit more. Now regarding the procedure and the reagent, there will be L1 and L2 reagent, okay, and there will be one standard. Standard is having that cholesterol level of 200 milligram per dl. The standard, whatever is given, that concentration will be 200 milligram per dl. For working reagent, L1 and L2, L1 will be 1 part, L2 will be 4 part, together will form that 1000 microliter. This is 4 part. I think I told the opposite. The L1 will be 4 part, L2 will be 1 part. Working reagent, distilled water, sample and standard. Here absorbance unit is gone, the standard concentration milligram per dl. So the answer will be at the final, the answer will be in milligram per dl, cholesterol concentration in milligram per dl. So this is the calculation, absorption of test minus absorption of blank minus absorption of standard minus absorption of blank into 200, because the standard concentration here is 200. Now what we will do, you will incubate it in room temperature it's for 15 minutes, and at 37 degrees centigrade it will be incubated for 5 minutes. Then at 505 nanometer wavelength you will check the result, the color of the quinoneimine dye, red color. So what is the principle? Increase the intensity of the color proportional to the concentration of the cholesterol present into the sample. And this is the end point, okay, no kinetic, only one point I am measuring, this is the end point. A linearity up to 750 milligram per dl, we can measure up to 750 milligram per dl with the help of this method, 750 milligram per dl linearity. So the kit can measure up to 750 milligram per dl very properly. After that, the result is not, result will not be told that it is correct. There is all that, you have that enzyme reagent, all that, you have cholesterol esterase, cholesterol oxidase and peroxidase. There will be supplied in 2 bottles, one will be L1 and another will be L2, both are enzyme reagent 1 and enzyme reagent 2. So all that method, whatever given the I have shown the enzymes, that enzymes will be supplied in 2 bottles, L1 and L2. So one L1 bottle you will take 4 parts and L2 bottle you will take 1 parts to make it up to 1000 microliter. Then you will follow the procedure. Now, linearity means the result up to 750 milligram per dl will be accepted after. If it, this will be 200 and this is 800. If you microliter, if you take, it will be 1000 microliter. Four part. Oh, sorry, 800 is to 400. Yeah. This is 800. This is 200. One is one disease related, this lipoprotein and all that, that is Tangier Disease. There will be yellow orange tonsil, peripheral neuropathy and atherosclerosis, all that will be there. So what happens here? ABC1, ATP binding cassette transporter 1. So there will be ATP binding cassette transporter 1 defect. Okay. Due to this, that cholesterol from cell to HDL, it will not move. So there is a decreased level of HDL as well as a decreased level of cholesterol. And there will be yellow orange tonsil. And this is found in Tangier Island in northwest Africa. And the specificity that yellow orange tonsil, okay, and that peripheral neuropathy, atherosclerosis, all that will be seen. And that defect is ABC1, ATP binding cassette transporter 1. So decreased cholesterol will be in the blood, but cholesterol will be into the tissue. So cholesterol, if you don't say, that is also fine, because here efflux of from the cell to HDL is not there. So blood, in the blood specifically it has to be decreased, and inside the cell cholesterol has to be increased. Okay. So just if you say that decreased HDL, that will be fine. Cassette transporter 1, ABC1. and there will be also muscular atrophy. Yellow-orange tonsil specific, yellow-orange tonsil and atherosclerosis, peripheral neuropathy and muscular atrophy. So cholesterol is present in the cell membrane. It will help in formation of steroid hormone and bile acid. So all that will be some of the uses of cholesterol. So principle I told that red color quinoneimine dye will be formed and the intensity of the color proportional to the concentration of cholesterol into the sample. And the sample, which sample you can use? You can use serum or EDDL sample. All that you can use. And light path will be 1 centimeter. Light path will be 1 centimeter. Anything else you want to know? No question, right?